You know, I think it's that continued innovative way of delivering healthcare that's different than what you can access in your community. That was one of the things that led us to OurHealth, and it's clear that the other employers feel the same way.
We've been with them for 6 years, and our employees really value the clinic. They're able to go to the clinic, get a prescription, and back, seeing the doctor within an hour from the time that they leave, which is unheard of.
We wanted to look at providing a benefit that can help our associates manage their health better, prevent maybe some disease, and control the costs, the healthcare costs.
The data shows that we're making an impact. It's working, 97% client retention rate. All the data suggests that we're going to spend $5.5 trillion on healthcare in 2025. So that's not a sustainable, opportunity for employers.
Part of our story is that we're there hand in hand. We're going to communicate, we're going to educate, we're going to help implement over the course of 6 months to make sure this thing, when it goes live, that it goes well for them and we represent them well as an employer. So when their employees, when they get into these clinics, then we start seeing the power of the clinics.
I think our employees thought we were going to open up this clinic. It was going to be this dark, dank, dingy basement clinic, and when they walked in the door, they realized that this is a real medical setting. It's an opportunity for employees to be seen, to be heard, to be cared for in a way that they can't get in the community, and they share that with us.
A lot of people want to liken us or compare us to some of the retail clinics that exist, like a CVS MediClinic or a Kroger Little Clinic. It's so much more than a traditional doctor's office, and people start to realize that value once they experience a visit with us.
We've got a platform for employers in a really sustainable way that helps them provide a great benefit for employees, that invest in their health and well-being, and at the end of the day delivers a real savings, a real return for those employers.
We have 80% employee engagement and 60% spousal.
We have just tremendous engagement, and I think that really is all about the way OurHealth treats their patients. They walk out and they have a clear understanding, they have a quality time with a doctor, which they don't get maybe from another physician. They have a time that's slotted and they spend that whole time with them.
From an employer perspective, they should measure success in 4 areas. If we're going to make this investment, pursue this strategy, are people using it? Are they having a good experience? So when they come in, do they enjoy the experience, and when they leave, they want to come back? Are they getting healthier? Are employees and their families getting healthier? And ultimately, are they and the employer saving money? If you look at our longest standing customers, their costs on a per member per month basis are much lower than anybody else in their peer group.
We're going into year 3. We've started to see some negative trend on our medical, which is important. For us though, it's about the stories. It's the cancers that were diagnosed that maybe wouldn't have been had they not been to the clinic.
We've had several life-changing events of individuals who maybe would never go to or haven't gone to a primary care physician are using the clinic, and some of which have revealed that they had a life-threatening disease. So it's actually been life-saving.
We're providing free care. I think one of the things that, as we move into the next phase is to really tell the story of what the value of this is, because it's not just the financials, there's bigger value here.